Hi, good evening. I'm Chris with InControl Medical, and today we'll be shooting a video. This will serve as a training video for the InTone device. It's a take-home pelvic floor therapy trainer that women use in the privacy of their own home once a day for 12 minutes to gain continence. So, we have our InTone device, we have our handheld unit, we have our InTone gel, and we have our workstation, which is also displayed here. We also have a pelvic model, which will serve as our patient for today's training session. So the patient will come in, they will lay with their pelvis flat on the exam table. They're obviously disrobed from the waist down, and they have their legs spread and their knees bent up straight into the air. The InTone device, you show the patient that there's a bump here, which acts as the bulb to inflate the balloon, and the black button is to deflate it. The patient will be instructed to put gel on the silver stimulation contacts, as so. So you put gel on the silver stimulation contacts and on the tip of the device. We then make sure that you spread it around so that the silver stimulation contacts are covered and there's enough gel on the rest of the InTone for easy insertion. The patient will then insert the device to the base of the balloon. If they have urge or mixed incontinence, the orientation of the device will be exactly as shown here, north and south, or the patient can turn it around this way, south and north. If they have stress incontinence, it will be inserted east to west. And for the purposes of the demonstration tonight, the training video, we will actually insert it into our vaginal model here, and then we'll pump it up. The patient will then drape themselves, and the white wire will be hanging outside of the drape. You will have the control unit plugged in to the computer. Once it's plugged into the computer, you'll notice that PC appears, meaning that it's connected to the PC. We will scroll up to Device, and we will set the time. And in setting the time, all that we are doing is we're orienting the device, letting it know that today is the first day that the patient will be utilizing their device, and it will record every subsequent day that the patient uses it from today's date. The device can be set specifically to the patient. So you'll go ahead and type the patient's name in and set their name as so. We have it listed as test in this scenario. We'll go up to the top of the screen and we will click on Setup. As soon as we click on Setup, you will see instructions appear that show step by step exactly what you need to do to program the stimulation for the patient. You will see a C appear on the device, which indicates that this is in setup mode. We will disconnect it from our computer and plug it into the patient's InTone. Note, you should always make sure that the short rows are always on the top when plugging this into the device. As soon as we plug it in, you will see a number appear. This number is the baseline number for the patient. Every patient has a different baseline number. So when they pump it up, a number will appear. You will have the patient do a quick Kegel, and the number should increase and then decrease. If when the patient squeezes, the number does not increase, that means that they have overinflated their device. You will instruct them to press on the black button and then reinflate it. At this point, if the appropriate inflation number has been achieved and it's comfortably snug for the patient and they can do a Kegel, all you will do to program the device is you will hit the start button, you will see a 0 flash on the control unit, and you will press the up key until the stimulation is delivered at an appropriate level. The appropriate level of stimulation being delivered is different for every single patient. So increase the stimulation gradually, and as we increase the stimulation gradually, we're looking for the patient to indicate when they feel a tingle on the pelvic floor and then a quick tug. So we're going to go up. Let's say the patient feels the tingle and then they feel the tug. You'll notice that the numbers flash as I increase. As it's flashing, it is not delivering the stimulation. Once it goes solid, it delivers the stimulation. So the patient feels a tingle and then a tug. So we'll go up one more. Let's say the patient felt the tug at an 8. We're going to go up to a 9. And we're going to see if she feels a strong tug at 9. If it's too high, you can always go right back down if needed. But typically they'll indicate that that's an appropriate level. If they have, you'll unplug it from their InTone. You'll go back over to your workstation and plug it into the computer. And as soon as you do so, you'll actually see set stimulation appear on the computer screen. All you then need to do is come over and click Set Stim. You'll now notice that the device has been programmed with the stimulation set at 9. You now have your stimulation set and the patient is ready to go through their 12-minute in-house training session for the InTone. So we go back over to the patient's unit, we plug it in, we turn on the power button, and at this point it's going to coach the patient through putting the gel on and inserting the device and pumping it up.
It is now time to do your pelvic floor muscle exercise.
Okay. At this point, the patient has inserted the device. They've pumped it up to the appropriate comfortably snug level. Their comfortably snug is a 6. You will just indicate to them that when they go home in the privacy of their own home and they use their InTone tomorrow to pump it up to the same number. At this point, the patient will start her 12-minute session. In order to begin the 12-minute session, she will hit the start button
InTone will begin by
and it will coach her through everything she needs to do.
It is important to lie still with your abdominals, legs, and buttocks relaxed.
So it takes a
Do not move
resting
InTone
baseline pressure.
InTone will begin your measurement now.
And then it will subsequently coach the patient through
InTone
their
will now
biofeedback.
guide you through a pelvic muscle toning session. You will complete 3 short contractions, followed by a longer contraction. It is important to maintain a relaxed breathing pattern and to keep your abdomen, buttock, and leg muscles relaxed while exercising. Between each contraction, allow your pelvic muscles to fully relax to avoid fatigue. Let's begin. Contract your pelvic floor muscles now.
When the patient squeezes, they'll notice that the red bars light up
Relax
on the side,
and breathe normally
and then they'll relax.
for 10 seconds.
They'll see a number 3 appear, and that's a 3-second quick squeeze, and then they relax for 10 seconds.
Now.
3-second quick flick, they squeeze, and then they relax.
And breathe normally.
You can pause the program at any time if needed. So it goes through 2 minutes of volitional exercises, coaching the patient through contracting their pelvic floor while they're breathing and then relaxing. So it's 3 quick flicks, 1 long hold, 3 quick flicks, 1 long hold. We're going to go ahead and continue the program. We've now completed your 2 minutes of volitional exercises at the beginning of your program. It has coached you through your 3 quick flicks, 1 long hold, 3 quick flicks, 1 long hold. It will now go through 5 minutes of electrical stimulation.
Now, relax completely and breathe normally. Now, you will begin your 5-minute InTone stimulation session. Please continue to relax the lower abdominal and buttock muscles during this time and breathe normally. As InTone contracts and strengthens your pelvic floor muscles, focus on the sensation of each muscle contraction and the complete muscle relaxation that occurs between each stimulated contraction.
You now see a 5 appear on the InTone unit. This indicates that it's delivering 5 minutes of electrical stimulation, and it will count down appropriately. At the 2-minute mark, the InTone will speak with you again to let you know that you should focus on the sensation of the pelvic floor to help promote awareness of the strengthening of the pelvic floor muscles. It'll then go down, and once it's completed the 5 minutes, it will go through and you will do a subsequent 5 minutes of biofeedback where it will coach you through the 5 minutes of your quick flicks and your long holds. At the end of the program, the device will automatically shut off. So you've completed your 12-minute InTone session. The patient will disconnect the device. Go ahead and deflate it by clicking on the black button. Remove the InTone. Go over to the sink, pump it up so that the grooves are exposed, and then wash this end of your InTone with simple soap and water. Dry it off. Deflate it and put it in your nightstand or underneath your bed or wherever you would like to store your InTone, and then use it again the next day. When the patient has completed their 2 weeks, they come back for their initial 2-week checkup. At that point, you will take the patient's handheld unit, you will plug it into your workstation,